audio feed broadcast out on YouTube. So we're holding tight and commenting on Kate Mulligan's cat at the moment.
To the chair, this is the host.
Yes.
I believe we fixed the issue. Please continue at your pace. Thank you.
You bet. Well, listen, my name is Joe Cressy, and I have the privilege of chairing the Board of Health. We had a little IT issue there that's been resolved, and our board secretary has confirmed that we have quorum plus a couple members' cats. So I'll call meeting 35 of the Board of Health to order. Welcome, everybody. The meeting is being held with directors and staff participating by video conference, and the public can continue to participate electronically and can watch the meeting streaming live on youtube.com/Toronto City Council Live. I'd indicated just before we had an IT matter there that we are working with the clerk's department around the months ahead and when and how we will be transitioning to a hybrid format for meetings to enable both virtual participation as well as for those who would like to participate in person with the appropriate public health measures and protections in place. And we ask for everybody's patience with any technical issues. Our clerk's team works mountains to make all this work. I'm now going to turn the floor over to Director Peter Wong to provide the land acknowledgement for today's board meeting. Director Wong.
Thank you, Chair Cressy. As we meet today on this virtual platform that is working well, the good mind tells us that we would like to begin by acknowledging Indigenous peoples of all the lands that we call home. The land acknowledgement is an expression of gratitude for the land and one that has been practiced long before European settlers arrived on Turtle Island, also called North America. We acknowledge this land out of respect for Indigenous nations who have cared for Turtle Island. Most importantly, we remember the history of these lands that have been tainted by poor treatment and lack of friendship with the First Nations. History that affects us all, as we are all treaty people in Canada. We have a shared history to reflect on, and a history that affects each of us in different ways. Our past defines our present, but if we move forward as friends and allies, then it does not have to define our future. So today, as settlers in Toronto, let us acknowledge that the land we are meeting on is the territorial, traditional lands of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and peoples. Is that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. Megwich Chair Cressy.
Miigwech, Director Wong, and let me say that a couple weeks ago, our board in camera participated in an Indigenous cultural training session with Grandmother's Voice. And on behalf of all of us, now that we're in public, a tremendous thank you to the team from Grandmother's Voice. And I think as Director Wong just noted, let us move forward as friends and allies and reflect at all times on the power imbalances that exist and how we may continue to address them. Are there any declarations of interest under the Municipal Conflict of Interest Act? Let me just see if you have one. If you could just raise your hand or unmute your mic. Okay, seeing none. Next, we need a motion to confirm the minutes from our board meetings on January the 17th and February the 24th. Could I ask for a mover for those? I see Trustee Donaldson. All those in favor? Opposed, if any, that carries. Let's proceed with the agenda run through. We do have 5 items on the agenda. There are 2 or 3 new business items, and we do have registered speakers on the first item and the second. So the first item, which is HL 35.1, response to COVID, we have a presentation as well as 2 registered speakers, so that's held down. The second item, HL 35.2, Ontario Public Health Standards Risk Management Reporting for 2022. We do have a registered speaker. The third item, item HL 35.3, 2022 Board of Health Committees and Appointments. We did caucus members of the board, and we heard back from a number of you, so I'm happy to move that now, unless anybody would like to hold that down. Okay, so why don't I, if it can be placed on the screen from the clerks, clerks will display a motion to make the following appointments to the Budget Committee, the Performance Appraisal Committee, and our rep on Alpha. Clerks, is that ready?
To the chair, it is ready, and Brad will display it on the screen in 1 moment.
Thank you kindly. Clerks, if you could just confirm, I haven't seen it. I'm not sure if I'm missing something. Clerks, could you just let me know what the status is? I can't tell if I missed it or if it...
To the chair, we are still working on putting it on the screen. We're just having a technical difficulty on our end, so it is coming. 1 moment, please.
There we are. So I'll place that. Thank you. And thank you to members of the board who reached out and put their names forward. All those in favor? Opposed, if any? Okay, that carries. Thank you. The next item is item HL 35.4. This is that City Council approved our Toronto Public Health 2022 operating budget submission. Would anybody like to hold that down? Okay, move the staff recommendations. All those in favor, opposed, if any, carried. That's for information. Same on the next item, item HL 35.5. City Council approved our Toronto Public Health 2022 to 2031 capital budget and plan. Would anybody like to hold that down? Okay, seeing none. Moved by Councillor Ainsley, thank you. All those in favor, opposed, if any, carried. And then we have 3 new business items that we're seeking to place on the agenda today. Members, you will have received copies yesterday as they were emailed around, but we want to introduce them here so that you have a time to review them further and for time for clerks to be able to put them up. So the first is item HL 35.6, request for an update on TOsupports and our vaccine engagement teams in the Equity Action Plan. So move to introduce that item. All those in favor to introduce it. It will then be added to the agenda. Okay, opposed, if any, that is now placed on the agenda. The second is item HL 35.7, request for an update on the impact of the COVID-19 pandemic on children and youth. This is a new business item submitted by Trustee Donaldson and myself. So this is to introduce it, to add it to the agenda. All those in favor? Opposed, if any, that carries. And then the third new business item is item HL 35.8, bringing a public health lens to indoor ventilation requirements. This is a new business item submitted from Director Mulligan and myself. And again, this is just added to the agenda for now. All those in favor? Opposed, if any, that carries. Okay, so then we will go back to the first item, which is response to COVID. A March 2022 update. There is a report, but I believe we have a presentation from Dr. Davila to begin, and then we'll hear from public speakers, and then we'll move it into committee. Dr. Davila, the floor is yours, and members, you should have an electronic copy of this as well that was emailed from the clerks this morning. If you want to follow along, it should be in your email. So, Dr. Davila, over to you.
Thank you, Mr. Chair, and good morning to the members of the Board of Health. I will thank my colleague Dylan Feist in advance for generously advancing the slides for us as I take you through a presentation the March 2022 update in respect of our response to COVID-19. The presentation does include a number of different components. First and foremost, it will cover a bit of a status update in respect of the epidemic itself here in Toronto. We'll provide you as well with an update on the COVID-19 vaccination campaign, a brief update on supports for children, youth, and schools. We'll then turn to some recent policy developments and just review those for members of the Board of Health. And then finally have a very high-level overview around our planning for the coming months, including the resumption of some services that unfortunately have had to be paused over the course of the last couple of years, but we are now in a position to slowly but surely restart and get back to as we are at this point in the pandemic. So thank you, Dylan. We'll just keep moving through the slides. The first part of the presentation, as I mentioned, is in respect of the status of the epidemic here in Toronto. And this is the latest version of our monitoring dashboard, a site that I know is quite familiar to members of the Board of Health. I'll call your attention, as I usually do, to different elements of the dashboard. On the upper part of the dashboard, you can see top left, the 7-day moving average on new COVID-19 cases, top middle, the weekly incidence rate on new COVID-19 cases. And those are sitting at respectively 245 and 62.3 per 100,000. By way of contrast, just to give the board a sense as to where we were on the dashboard the last time we met, which is now 63 days ago, the 7-day moving average on new COVID-19 cases was from the dashboard on January the 12th, 1,845. And that weekly incidence rate was just under 600, sitting at 597.4. So clearly a significant shift in where we are compared to where we were 2 short months ago. Looking at new hospitalizations, that's the upper right-hand side of the slide. You'll see our 7-day moving average is now sitting at 2.9. Back on January the 12th, this was sitting at 29.3. Looking as well, sort of the middle left-hand side of the slide, active daily COVID-19 outbreaks in institutions. You'll see our most current report has that sitting at 14. This was well over 200 63 days ago now. So we can see that things have shifted significantly over the last several weeks, and this is a good thing. This is, a market improvement compared to where we were at the peak of that Omicron wave. Clearly, that peak is behind us. You've heard me say that, I'm sure, through the media several times, and this is a good thing, and it is due in part to all the efforts that have been put forward, yes, by us at Toronto Public Health, yes, by our Team Toronto partners, and perhaps most importantly, the people of Toronto who've participated in our efforts to address COVID-19 in our midst. It's interesting, though, that, we are in very different circumstances since the last Board of Health meeting, as I've already said, now 63 days ago. But in addition to the numeric values that we're seeing here on the indicators, as we enter this new phase of the pandemic, it does require a change in how we actually view the indicators. And so right now, I will call your attention to the bottom of this slide, outside of the realm of public health, but the bottom of the slide, as you'll see here, captures indicators in respect of health system capacity. And if I can call your attention in particular to the one at the bottom in the middle, the acute bed occupancy rate. Earlier in the course of the pandemic, we had watched this number very carefully, as did our healthcare system partners, in order to get a handle on, how much demand there was based on COVID-19 infections for acute beds and for hospital acute level services. And so we were always worrying about that number getting too close to 100%. It's interesting now, though, in speaking with our healthcare system partners, that they're actually viewing this a little bit differently. And they're looking to see more of a higher number here with the acute bed occupancy rate, as we're seeing less demand on hospital-based services related to COVID-19 infection itself, and more around catching up on the services that have had to be delayed over the course of the last 2 years as part and parcel of COVID readiness, I should say, and COVID response. So interesting that we are starting to see a different way of understanding the indicators and looking to different indicators at this point in the pandemic. But our healthcare partners are also looking at our indicators differently as well. So we'll have a little bit more on this notion of different indicators and how we need to look at what our progress is and how best we understand where we're at in the pandemic at this point in time a little bit later in the presentation. But I thought I would raise that here, as I think that's an important part of our monitoring dashboard and understanding where we are at this point in time. So turning to the next slide, we're now looking at a little bit more by way of detail on some of the indicators we're currently following. And as you can see here, this graph demonstrates, the course over the pandemic of new hospitalizations depicted in the dark blue line, and in the light blue shading, we see the 7-day moving average of cases that are currently in hospital. And again, this depicts those hospitalizations and those currently in hospital over the course of the entire pandemic. So towards the right-hand side of the slide are the most recent data we have available. And as you can see, there's been a significant decline, and as indicated in the title, significant decline in cases currently in hospital and for new hospitalizations, certainly since that peak of Omicron in earlier this year, early January. So we're obviously pleased to see that decline, and of course are continuing to monitor hospitalizations as a key metric, recognizing that this is a delayed or lagging indicator of COVID-19 activity in our community. Turning to the next slide, another indicator that you've heard a lot about, a lot more about recently are wastewater trends. And just to give you a sense as to what is happening here locally, we have here the wastewater signals as depicted at each of the different Toronto wastewater sites on the left-hand side of the slide. And on the right-hand side of the slide, we have the wastewater data as presented by the Ontario COVID-19 Science Advisory Table. Altogether, these data sources show that wastewater trends are stable at this point in time. I would just advise, of course, that this is still a relatively novel indicator, certainly providing a great deal of value to us, particularly as the province changed its testing criteria, but still a novel indicator that we are assessing in concert with our partners, but are finding some utility out of at this point in the pandemic. So we will, of course, continue to keep you apprised of this. And as we mentioned last time at the Board of Health, this is something that we are now publishing on our public website so people can follow along with us. So turning to the next slide. Just to give you a recap on the entire scene from an epidemiological perspective. I've now said this a couple of times, but just here in writing to confirm to you that multiple indicators across the board do show that the Omicron wave has subsided since peaking in January. Whether we're talking about wastewater surveillance, whether we're talking about the incidence of outbreaks in various facilities throughout the city, we do know that we have seen a significant decline since early January. This being said, we should expect that as restrictions and public health measures have been lifted by the province, the most recent of which occurred today, we should expect that that lifting of restrictions will lead to increased community transmission. So we should expect to see increased COVID-19 activity in the coming weeks. In fact, turning to the COVID-19 Science Advisory Table, in their March 17th update, so update late last week, they did note that transmission, hospitalization, and ICU occupancy will likely increase over the next few weeks, but they anticipate that this will be less so than what was seen in January of this year, and for a limited period of time, if changes in public behavior are moderated or are only moderate, to use their words. I think the other important point that's worth the board's consideration and attention is that we do know that the proportion of COVID-19 cases caused by the more transmissible Omicron subvariant BA2 is growing. Thankfully, there is no evidence of increased severity thus far with BA2 compared with the original Omicron variant, but it is important to note that we are seeing more and more of this subvariant in our midst. When I last looked at the data for the last week in Toronto, it was for which data were available, it was sitting at roughly 17% for Toronto, and those are data from late February. So we are, of course, continuing to monitor that with the sequencing happening at the provincial level. So we await data from them. They're the ones that provide us with that data, and we're continuing to monitor and follow that in order to inform ourselves and our actions, and of course to inform the public and you as members of the Board of Health. Next section of the presentation now focuses on COVID-19 vaccination. So turning to the next slide, I'm pleased to say that COVID-19 vaccine coverage does continue to increase throughout the city. The latest data that we have shows that the share of Toronto residents aged 12 years and older that are vaccinated with dose 1 now sits at a little over 91%, with dose 2 just shy of 89%. These are remarkable figures. I just cannot say that enough. And when we look at the total number of doses that has been administered in the relatively short period of time of 15 months, it now sits, as of Thursday, March 17th, at 6,822,180 doses of vaccine administered in 15 months' time. You know, if you had asked me, you know, back in 2019, whether this would have been possible, I'm quite certain I would have told you I highly doubt it. So I cannot say enough about the remarkable efforts of the Team Toronto vaccination partners, including those here at Toronto Public Health, and the supports we've received from colleagues of the City of Toronto. This truly is a remarkable achievement and one that is worthy of celebration. As I've said to others here at Toronto Public Health in the city, this is not an occasion, however, on which to rest on our laurels. We are continuing to do everything we can to continue to see vaccine coverage increase, especially amongst those who would benefit most from the extra protection of vaccine, the third doses, those who are most at risk for serious outcomes associated with COVID-19 infection. So as you can see here on the slide, we know that nearly 65% of eligible Toronto residents aged 18 and older have had 3 doses on board. We're not stopping there, but this is, again, something to remark on and to say that to give our Team Toronto partners a pat on the back for their excellent efforts to date. But again, not a reason to stop, a reason to continue to find ways to drive this number up. In particular, I'll note here that over 83% now of eligible individuals aged 70 years and older have received a third dose. Incredibly important, as we know from evidence both here and from around the world, that it is this population that is most susceptible to very serious outcomes associated with COVID-19 infection. And then finally, at the bottom of this slide, we're talking about vaccination rates amongst the youngest members of our city who are eligible to receive vaccine. Right now, those 5 to 11, 57%, have 1 dose on board, and 39% as of the 17th of March have 2 doses on board. Turning to the next slide, something that the board is not going to find particularly surprising, there are differentials experienced in terms of coverage of vaccine by neighborhood. And here on this particular slide, we're showing you third dose vaccination coverage for Toronto residents aged 18 years of age and older by neighborhood. We can see that there are some parts of the city that actually have excellent coverage, although again, not satisfied there, but still very good coverage. Whereas other parts of the city, notably the Northwest, you can see requires more attention, and we are certainly placing our attention there. as you'll see on the next slide. We recognize that we have to remedy the disparities as seen on the map. We saw similar disparities earlier in our vaccination campaign and have successfully addressed those. So again, we're putting the knowledge we have gained over the past 2 years to good use. We're making sure that we're promoting equitable access to the COVID-19 vaccine, working with our Team Toronto partners to make sure that vaccine is available through multiple channels, whether it's city-run immunization clinics, mobile and pop-up clinics within communities, hundreds of school clinics, special event vaccination clinics. You've probably heard of Vax and Read, Vax the East, and now this week we've got Vax and Spring clinic events happening all over the city with, a little bit of special communications and special efforts so that people recognize that there are opportunities within their communities to actually get vaccine and to have questions answered around vaccine as well. We've got over 525 pharmacies and a number of primary care settings also part and parcel of the various channels through which vaccine is accessible. Of course, these efforts are bolstered by the incredible work of our vaccine engagement teams. They focus on supporting equity-deserving groups that are disproportionately and most negatively impacted by COVID-19. We've made sure that they are funded in order to be able to do this really important work so that communities that perhaps have had challenges in the past with engaging in healthcare or engaging with government are actually provided with information that they need to have in order to make good decisions to support their health. Finally, over and above the on-the-ground efforts, we do as well have the city's VaxTO campaign. And at this point in time, they're working hard to reach Torontonians who are eligible for the COVID-19 vaccine. And they're really looking right now at older individuals who we know are eligible to receive third doses but haven't yet made avail of those resources at this point in time, recognizing that there are particular populations who are at higher risk. We're making sure that they're aware of their eligibility for vaccine and supporting them in their ability to actually get vaccinated. So turning to the next slide, we're continuing all these efforts, and I think it's really important that the board hear that these efforts do pay off, and we're seeing that in our numbers. There is no question that Toronto is a leader in vaccine coverage amongst major cities. Our team here at Toronto Public Health has taken the time to look at what is happening in other jurisdictions. They've conducted a recent jurisdictional scan comparing our vaccination progress with that of 5 large cities throughout the world based on available data. And we found that Toronto ranked at or near the top in terms of COVID-19 vaccine coverage. And this, I think, is incredible testament to the team here at Toronto Public Health, testament to the city, and certainly testament as well to the Team Toronto vaccination partners. Finally, I would just add that since the scan was actually completed, I can share that Toronto has surpassed New York City here for first dose coverage amongst residents age 5 and older, with us now sitting at just a little over 89%, and New York sitting at a little over 86%. So kudos to the team for their continued efforts on vaccine and getting vaccines and the protective benefit of vaccines out to Toronto residents. Turning to the next slide, just a high-level summary for the Board of Health in respect of recent vaccine approvals. There are new tools in our toolkit. We've got new vaccines on board, or at least soon to be available, approved by Health Canada. They do work differently from the mRNA vaccines and hopefully offer some new options for people to protect themselves and others around them from COVID-19. When we do get supplies, we will work with our vaccination partners to make sure that these options are available in accordance with the policy set out by the province. And you may have also heard just recently, Health Canada has authorized the use of Moderna vaccine in children aged 6 to 11. So again, more options on the horizon. Turning to the next slide, just further information for you in respect of what we're doing to strengthen vaccination here in the city. We are expanding vaccination capacity and preparing long-term for COVID-19 vaccine administration in concert with our Team Toronto partners. We are working on new approaches to make sure that we're taking advantage of every opportunity we can to facilitate access to vaccine. We have pilot projects underway to support primary care settings and pharmacies in administering the COVID-19 vaccine. We're hopeful that we'll get good results out of these pilot projects because we know that the more we are able to provide vaccine in settings that are closer to home, pharmacies being one of them, they are all over the city, the more we're able to support pharmacies in being a viable channel for vaccine, we know the easier it will be for the longer term for people to access vaccine through those settings. We know that a number of people have important questions around vaccination and that the best way to get those questions addressed is in the context of a trusting relationship with their primary care provider. There have been challenges, no question, in terms of getting primary care involvement in the COVID-19 vaccination campaign, many of which are related to, needing to come on board the system to enter vaccine information. We're supporting primary care settings with these pilot projects to figure out how we might make it easier for them to participate in the COVID-19 vaccine campaign so that we can actually ensure that people can have clear, useful conversations in the context of a trusted relationship with their primary care provider. And then finally, you will have heard that, none of us is safe until all of us is safe. And that speaks to the need for global vaccine equity. We know that there are significant swaths of the population of the world, particularly those in low-income countries, who have not yet had access to COVID-19 vaccine. In fact, as of February, only 10% of the population in low-income countries have received one dose of COVID-19 vaccine, compared to nearly 80% in high-income countries. So as a result, I recently joined colleagues from around the world in calling on G20 leaders to expand access to the COVID-19 vaccine in low-income countries, taking a series of steps that will actually help to get this moving forward. So these are just a few of the other activities that we're taking on here at Toronto Public Health. Turning to the next section of the presentation, supporting schools and students. Next slide. We have been working very hard with our Toronto school boards and our schools on ensuring that we are sustaining the best possible practices in the education sector and doing the best we can in the context of a pandemic to ensure a healthy and safe environment in our schools. I think we're fortunate to be in a position where COVID-19 vaccine is widely available for school-aged children and youth, and this will certainly go a long way for us towards ensuring safer schools on a go-forward basis. We certainly have increased our knowledge, both us as public health in partnership with our school boards and the schools themselves, on effective infection prevention and control measures to mitigate the spread of COVID-19. That knowledge has evolved and has continuously been updated and put into practice within school settings. And so I think that this, in combination with the really deep relationships we've formed over the course of the last 2 years with our school board partners and with schools themselves, puts us in a situation where we're well positioned to respond to COVID-19 in school settings in the future. We know that we're, now at the point, March break just behind us, we're approaching the end of the school year. And as that end, approaches even closer, we're continuing to work with our education sector partners, thinking back on, what we've learned over the course of the last couple of years, and planning to use those lessons learned to optimize the path forward in schools for the school year to come and hopefully beyond that. So we're looking forward to sharing further details of this work with the board in the not too distant future. You'll see that I've got a few recommendations here for the board in this respect. We know that there is much that needs to be done. We do need the ongoing support of other orders of government to support school boards and schools to implement measures to protect against COVID-19. And particularly, that support is going to be needed for those initiatives that are more resource intensive. Thinking here of things like facility upgrades, where that is actually best suited. These are the kinds of things that we're going to clearly need greater support from other levels of government on, while we're keen to participate in those efforts, of course, and in the discussions. I would just finally say to the board that in all of this work, it is really important that we stay focused on achieving a balance, around effective solutions that are also reasonable and practical to implement and that are commensurate with the risk that exists within the school setting. So lots of opportunity there, I think, for us to continue the great work that we've done with our school boards and our school partners, and as well with the other levels of government in respect of how best to support the education sector. So turning to the next slide. Beyond infection prevention and control and prevention and mitigation of COVID-19 and its impact within schools, we also need to think about students' mental health and well-being. And this certainly has been the focus of a lot of attention over the past several months now. We know that the COVID-19 pandemic, including the difficult but necessary move to remote learning at certain points, has had a detrimental impact on mental health and well-being of children and youth. And it is clear, no question, that a coordinated and concerted effort is needed. So we are working with our partners to scope interventions that actually support kids' mental health now and for the future, and look forward to sharing more with the board about our plans as they come more to fruition. I do think it is worth setting some expectations on this work, however, particularly as I think everyone has slightly different perspectives on what it is that public health's role is. But to this board, it won't come as a surprise to hear that our role at local public health is not so much around mental health clinical service or service provision, but rather as a local partner on the ground to help conduct mental health status assessments and to support prevention at a population level, at a school population level, and to connect people within the school, students in particular, and our youth, those who are in need, with the appropriate clinical services. So we'll have more for you as this becomes more fulsomely developed, but I think it's important that the board knows that this is not lost on us, that we are quite cognizant of the need for a concerted effort amongst all partners involved, education, public health, and yes, healthcare partners as well, to address this important public health issue and to support positive mental health outcomes for our children and for our youth. Turning to the next slide and the next section, we're now on the COVID-19 policy updates. And Mr. Chair, I will try to move us quickly through this. I do apologize. There's much to cover, in these presentations. The board will be aware that there have been, over the course of the past several weeks, the removal of provincial restrictions in respect of COVID-19 protections. You know that earlier this month, the vaccine certificate was withdrawn by the province. Outdoor capacity limits, indoor capacity limits, and physical distancing requirements were also taken away as part of those provincial moves earlier this month. Today, the province has removed masking requirements for most indoor settings. However, masking does continue to be required for now in places like public transit, hospitals, long-term care homes, and other congregate living settings like shelters, amongst, just to name one, likely until the end of April. Right now, they're saying at least April 27th. And of course, monitoring is occurring to adjust on an as-needed basis. Turning to the next slide, there were some, in keeping with this, local public health measures that were revoked. On March the 1st, 5 class orders and letters of instruction were revoked by us here at Toronto Public Health. And this was in order to, one, reflect the different phase of the pandemic that we're in right now, and two, to actually make it more cohesive a response in respect of how we are managing COVID-19 and what restrictions are in place, given that the province is changing their regulations as well. The city's masking bylaw expired today in line with changes to the provincial masking requirements. We have some special requirements for apartment buildings that are set to expire very shortly in early April. However, these continue to be recommendations that we would put forward to people who are responsible for the operations and the smooth running of apartment buildings. Enhanced cleaning and actually having cleaning schedules, having some signage, these kinds of things are good practices and continue to be part and parcel of the guidance and support that we are providing both to organizations and to individuals throughout the city. I think it's important that it's important for you to know that we are continuing to monitor COVID-19 indicators. We are in close contact with our provincial counterparts. And should circumstances change, we're prepared to work with our provincial counterparts to explore, what might make sense by way of local public health protective measures at that time. So as we have throughout the course of the pandemic, we adjust our actions in concert with what we're seeing on the ground. Next slide. I've already mentioned that we continue to recommend that individuals follow public health protective measures, as protection for themselves and for others against COVID-19. We continue to update our guidance and resources on the city's website, and that will continue for the foreseeable future. We are providing advice to people should they have questions through our hotline. It is not as busy as it might have been earlier or at different points in the pandemic, but there are still a number of people calling and asking for advice, whether it has to do with protective measures or measures for self-protection, or whether it has to do with vaccine. And we're pleased to continue to provide that guidance and support to Toronto's residents who are seeking that kind of information. And then finally, as you can see here on the slide, recognizing that COVID-19 will continue to spread in Toronto, the Toronto Voluntary Isolation Centre will continue to operate through to March 2023, thanks to continued funding from our federal partners at the Public Health Agency of Canada. Next slide. And the final section of our presentation for today, Mr. Chair and members of the board, looking back and looking to the future. Next slide. You probably heard, as there was much made in the media, of the fact that we have now crossed that 2-year mark since the World Health Organization declared the COVID-19 pandemic. That happened back on March 11th, 2020. On the one hand, one can hardly believe that 2 years have gone by. And by the same token, I think many of us, certainly here at Toronto Public Health, are probably feeling like it's been the longest 2 years ever. But I would say this, over the last 2 years, we have constantly had to adapt our approaches and our strategies in concert with what we're seeing. And certainly our surveillance strategy is not excluded from this need to constantly adjust and adapt. So given that we are now transitioning to a new stage in the COVID-19 pandemic, we know that we have to make changes in our surveillance strategy, including for things like indicators and reporting. We know that testing is now limited to a very select group of people. So other data and other indicator sources are required to help us understand the state of COVID-19 activity, given that we are in this new phase. So the kinds of things that, and this is an area of active work for us here at Toronto Public Health. We're looking at focusing on trends rather than following cases so closely day by day, which we know is less valuable at this point in time. We're more interested in overall trends. We're looking at things like mobility data, especially as people are increasingly doing things like returning to office and now have more access to a wider variety of activities throughout the city. We know that mobility data will become very important to us, or more so now at this point in where we are in the pandemic. We also have spoken earlier about hospital capacity indicators, that yes, of course, we want to monitor how many people are showing up to hospital as a result of COVID-19 infection. But at the same time, we have to recognize that hospitals are wanting to see themselves and their wards as busy, because it's indicative of the fact that they are doing more by way of catching up on the backlog that COVID-19 created in a wide variety of other acute care services. We're watching wastewater, we're looking at outbreaks, and of course, as always, we are looking at international trends. What is happening in other jurisdictions has often predicted what might happen here. And so we know that that's certainly something to watch for. We know that it's not a straight, direct comparison, but it is something that gives us yet another data point to triangulate with all the other sources that we have to help inform, what we might anticipate seeing, and therefore what kind of action is needed. As well, we know that at this point in the pandemic, we have to reimagine and readjust with how we assess risk. We know that as broader public health regulations and measures are removed, that the people of Toronto need to be supported in assessing risk based on what the situation is that they're walking into and what their unique personal circumstances are. So we are actively working with other public health units, as we did, as you may recall, at the very beginning of the pandemic, when it came to, actually creating monitoring dashboards in the first place. This is something we did in concert with our other local public health partners around the province. We find ourselves, again, at this new stage in the COVID pandemic, once again reconvening with our local public health partners to review what new ways we can put into place together to help individuals assess their risk and help people make informed decisions about what protective measures they should take. So we are being quite prudent. We know that this is important work. So we are working with our partners around the province to make sure that we're doing this in a well-informed way and in a manner that actually is likely to be seen as supportive as it can be for the people that we serve. Next slide. And while this is a presentation in respect of COVID-19, and as much as COVID has taken up of our time and attention over the last couple of years at TPH, we are at the same time also addressing existing and emerging public health issues. As I've mentioned to you before, there were a number of important public health functions that had to be paused due to the demand of the COVID-19 response. And unfortunately, this has exacerbated certain existing public health issues. As well, we also know that over the course of the last couple of years of the pandemic, other health issues have emerged. We know that there are challenges. There were pre-existing challenges before the pandemic that have only gotten worse, we suspect, in respect of sexually transmitted infections. We spoke a little bit about children and youth and mental health and well-being, but we know that mental health challenges have also really been exacerbated over the course of the last couple of years, not just for children and youth, but for many of us throughout our community. And of course, I would be remiss if I didn't mention the drug poisoning crisis and the challenges that were clearly there before the pandemic, but have frankly gotten much worse over the course of the last couple of years. So there's no question. We do know that the pandemic has really highlighted the need for us to work with our other partners on addressing health inequities and in addressing the social determinants of health. So we recognize that there is this opportunity as we enter this new phase of the pandemic to, yes, continue the COVID-19 response and use our resources as best as possible to mitigate the impact of COVID-19 on the health and well-being of our city. And at the same time, we have an opportunity to enhance the other public health service offering, the other public health functions that are also critical to the experience of better health and to the reduction of inequities in health status here in the city, which is exactly what we're doing. Next slide. Last but not least, a few words on supporting our public health workforce. And I would say this, our successes in responding to the pandemic and in that remarkable vaccination campaign are due in large part to the really remarkable efforts of Toronto Public Health staff. There's no question other partners were absolutely engaged and are certainly worthy of thanks, but I would be remiss if I didn't bring to the board's attention the remarkable role played by Toronto Public Health staff throughout the entire COVID-19 response. Much has been said about the very important role of healthcare workers throughout COVID-19 and the toll that the pandemic has taken on them. And they are certainly deserving of that. They have given their all within our acute care partners, and our community care partners have given their all to get us through a very, very challenging time. So my thanks certainly goes to them. But no less worthy of acknowledgement are our public health staff and public health workers and their contribution to the pandemic response. I am really mindful of the challenges our staff had faced over the course of the last couple of years and the incredible amount of work that they have put in to support Torontonians throughout the pandemic. One of the greatest challenges I think our city has faced perhaps ever. So I would say this, to the board, we have been well served by our team here at Toronto Public Health. And they are exhausted 2 years in. So their well-being is top of mind for me. And it's my priority at this point to offer them some respite in the weeks and months to come in order that we can actually be well prepared to address the needs, both COVID-19 related and beyond, of the residents of this city. Mr. Chair, if you'll indulge me just a little bit more, I would just like to read to the board some of the statements I made at our final regular press briefing just a couple of days ago. This was delivered on March the 10th, because I think it bears repeating. This is about thanking the people at Toronto Public Health, who, like everyone in Toronto, lived through the fears and uncertainties of COVID-19. And at the same time, their job was to help subdue it. They were pushed and pushed and pushed beyond anything I could have imagined asking of them. And I say this in all sincerity. They are my heroes. The team at Toronto Public Health, the staff at Toronto Public Health are my heroes. And I would dare say to the people of Toronto that they are your heroes too. Finally, to the board, I would say this. One, I thank you for your support over the last couple of years. And I'm optimistic about the future. We have seen that things have changed dramatically over the course of a couple of weeks. And certainly we've seen that our efforts over the last couple of years are starting to pay off. So I think there is reason for optimism. But I also think we need to be mindful of the facts. As we go forward, cases will go up. We've seen it happen all around the world as restrictions lift. And I think you should know that it is expected here as well. But with the remarkable team that we have here and with our Team Toronto partners, we will adapt as need be. I do believe that we can still live reasonably well with COVID in our midst, and we will be ready to respond to COVID's next move. So, I would say once again to the board, thank you. Thank you, Mr. Chair. Thank you, members of the board, for your ongoing support. I am truly, truly grateful for that support, and am hopeful as we're entering this new phase that does hold a fair amount of promise for all of us. Promise that I can assure you that we at Toronto Public Health will work hard to help realize in the weeks and the months to come. So with that, Mr. Chair, I will wrap up the presentation and hand it back to you.
Well, thank you, Dr. Davila. We have two public speakers on this item, so we'll turn it to hear from them, and then we'll move it into committee for. So first, if our team at clerks, we have Liam. Is Liam connected?
To the chair, that speaker is not connected. To the chair, that speaker is not connected.
Our next speaker, we have Derek. Derek, do we have you connect?
Yes, to the chair, that speaker is connected. One moment, please.
Thank you.
I am now unmuting Derek's mic.
Thanks, Derek. You're being unmuted.
Hi,
welcome to the board. You've been here before. You'll have 5 minutes, and you can begin.
Okay, can you guys just hear me, though?
Yep, we can hear you fine.
Can you guys hear me, though?
Hear you, thank you.
I'm just going to start my clock here. I just want to say by me speaking at this meeting, this shall not be deemed to be in any way my consent expressed or implied, and doing so is fraud. God bless Her Majesty the Queen, and long live Her Majesty the Queen. And I just want to point out that I provide the links to everything I cite in my written presentation. So in this report, it mentions of an analysis of COVID-19 case fatality data. So this is from one of those scientific literature articles Dr. Davila speaks of from time to time from off of the NCBI National Center for Biotechnology Information site titled, "Is a mask that covers the mouth and nose free from undesirable side effects in everyday use and free of potential hazards?" I want to read what it says at the very end in the conclusions they make that in early October 2020, the WHO, the World Health Organization, also publicly announced that projections show COVID-19 to be fatal for approximately 0.14% of those who became ill, compared to 0.1% for endemic influenza, again, a figure far lower than expected. And below my screenshot in my written presentation, I provide the actual footnote, screenshot of that, they're citing, which shows the source is indeed from the WHO. So an infection fatality rate of 0.14% for COVID and an infection fatality rate of 0.1% for endemic influenza. Conversely, that also means endemic influenza has a survival rate of 99.9%, and COVID has a survival rate of 99.86%. But remember, the WHO publicly announced this back in October of 2020 when we were probably dealing with the Alpha variant. Since then, it's gotten less virulent with the Delta variant, and as Dr. Moore recently told Oliver Moore of the Globe and Mail, that Omicron is roughly half as virulent as Delta. It'd be interesting to see which has a higher infection fatality rate now, endemic influenza or Omicron, but unfortunately, Dr. Davila and Dr. Moore, they don't release and inform the public on that data, do they? But not to worry, as Tamara Ugolini of the Rebel News has pointed out in an article she published the other day titled, "Trudeau Government Commits $75 million to Vaccine Injury Compensation Program." I take it that's for all the vaccine injuries the Prime Minister now realizes these COVID vaccines are causing. Then there's Joseph Mercola, who published in the Epoch Times the other day that 9 in 10 COVID deaths, and this is in the UK, are in vaccinated people. This sounds pretty far-fetched until I actually looked at the data myself in the UK's weekly COVID vaccine surveillance report. What you'll find if you do some easy math is that there's two tables in table 12 of this document. If you add up total COVID deaths, what you'll find is that the unvaccinated make up 10% of the deaths. However, what you'll also find is that the vaccinated make up 90% of the deaths. But whether if it was 1 dose, 2 doses, 3 doses, 90% of the COVID deaths were in those who were vaccinated. Not only that, but the higher the doses, the higher the death counts occurred, especially in those with 3 doses. And let's not forget, the whole purpose of getting vaccinated against COVID was supposedly so you wouldn't die of COVID to begin with, which is the opposite of what this data shows is happening here. This is from something called the Daily Expose from out of the UK, where the headline reads, "Official Government of Canada data is truly terrifying as it suggests the triple vaccinated have developed AIDS and are now 5.1 times more likely to die of COVID-19 than the unvaccinated." This is from a YouTube clip this past December where the head of the World Health Organization, Dr. Tedros, at a press conference said, "It's better to focus on the groups who have risk of severe diseases and deaths rather than, as we see some countries are using, to give boosters to kill children," which he said,
Derek, you'll
which
have
is not
15,
right,
you have
end
15
quote.
seconds left.
I
if
just
you
want to
wrap
add,
up.
and I just want to end on saying that, which is what I suppose probably happened to Dan Hartman's son, Sean, after he took the COVID
No,
vaccine.
you're just
And
at
that's my
5
time.
minutes. Thank you very much, Derek. Appreciate it. Are there any questions for Derek? Okay, seeing none, thank you very much. Let me just do another check. Did Liam Sturgis, was he able to connect?
One moment, Chair, checking now. To the Chair, they have not connected. We've also sent an email to the Speaker asking them to confirm.
Okay. Thank you for that, Nahom. So we're going to move this into committee now. And so let me just open it up. I'll start to do a list. Those with questions for Dr. Davila. See those who have questions. I have Trustee Donaldson, Councillor Fillion. We'll get started with that, and then I'll come around to see who else is there. Trustee Donaldson, when you're ready.
Thanks, through you, Chair. Thanks for this really comprehensive report, Dr. Davila. I just have one question on the indicators, because I think a big part of the story in all of our public services for the last 2 years has been our workforce capacity and the level of health of those heroes who are working in our systems to do that work. So when you're thinking about new indicators going forward, I'm just curious, is there any public utility to including indicators about the capacity and the level of health of our workforce? Thanks.
So through the chair, thanks for the question. So are we talking about healthcare, public health, both?
I think both, yeah.
Yeah. So I think that you raise a very good question, Trustee Donaldson, and I would say this. Certainly happy to take at this and look at it. We do look at absenteeism data when it comes certainly to the city and to Toronto Public Health. I can't speak quite as well to that which is being monitored in the healthcare system. I do believe that they are actively looking at absenteeism data as well. And I think the other point that's worth it for the board to be aware of is that this is one of those interesting areas where public health does touch on occupational health and safety. We do let occupational health and safety be the lead in matters that are truly within their purview. But of course, we interface with them on a pretty regular basis, as we have throughout the course of the pandemic. So certainly happy to take this back and see what might be being done with our Ontario Health partners and our healthcare partners in respect of the healthcare workforce. I know they're watching that very, very carefully. We too are monitoring very carefully, hence my message that's certainly going out to Toronto Public Health staff to, while we're in this period of relative lull from a COVID-19 perspective, to take the opportunity to get a little bit of respite and take the opportunity to recharge, as we don't know yet what the future holds for us. And we want to be ready on behalf of the people of Toronto. And the only way we can do that is to make sure that people actually have that opportunity to refresh and recharge. I think maybe that's not the only way. It's certainly one component of it. We are also talking, interestingly, to colleagues from the military service and from the United Nations as well, to find out about how they support their respective teams as they have finished, significant deployments and high stress situations. We recognize that there are clear differences between ourselves and say the UN teams and the military, but we do believe that there are lessons we can learn from them as well. So just so the board knows, these are the kinds of things we're actively exploring.
Councillor Fillion.
Thank you, and thank you, Dr. Davila. Just wondered if there was any update on the availability of antivirals, both the supply and how easy it is for someone to access them.
So through the chair, Councillor, there is reasonable supply of Paxlovid and sotrovimab in particular, monoclonal antibody and antiviral treatment. I expect that more will be available over the course of time, but supply is not an issue at this point in time. Interestingly, because it is a treatment, it is actually not within our purview as Toronto Public Health. It is within the purview of the healthcare system. And of course, we support them through that. So we do provide people, for example, information. Should they call us on our hotline or connect with us through other channels, we're able to direct them to the centers to actually get access to that service. And we are in active conversation with our healthcare partners on how might we increase access to these valuable treatments. We know that people actually have to get tested, so we're actually also supporting communications messages around when should you get tested, and are working with our provincial partners and our healthcare partners to make sure that that message is better promulgated, because we know that's a really key tool we have in our toolbox, something we didn't have, as recently as a few months ago. These are new resources available to us in our COVID-19 response.
Great, thank you. And I believe both Pfizer and Moderna are developing specific vaccines for Omicron. Do we have any information on when those might be submitted for approval, and when they do become available, do we anticipate a large new demand for vaccinations?
So through the chair, Councillor, I don't have specific information with respect to when we might anticipate access to new vaccines that we know are under development. We've all heard through media channels that lots of work is happening in respect of these new vaccine developments. No specific word yet here in Ontario, but of course that is under the federal and provincial purview. We're in regular communications with them, so as we hear information about their plans on the go forward, we'll be sure to bring that to the board as we hear about it.
Right, thanks. And just change in subject, do we have data of province-wide, I guess it would be the province who would keep it, on hospitalizations and ICU admissions by vaccination status and age and perhaps underlying conditions, and then perhaps more importantly, some combination thereof, for example, that X percentage of those in ICU are over the age of 70, unvaccinated, and have underlying health conditions. Is that kind of data available?
So through the chair, Councillor, briefly, yes. Not always packaged up in the way that I'm sure we would like to have it, but with our data systems and the way data are collected, it is sometimes a little bit challenging, but yes, those data are actually collected in the system.
And can members of the public access that information, or is it kind of off somewhere?
So through the chair, Councillor, I think there are different ways in which the information is packaged up. It may not all be packaged up in quite the format that you've described, but certainly there are public sources. I look at the Ontario dashboard that's put out by the COVID-19 Science Advisory Table. Our colleagues at Public Health Ontario also produce a number of surveillance reports. So I would imagine that different slices of that which you're describing are captured through reports such as those over and above that which we report as Toronto Public Health on our website.
Would you be able to provide like kind of a basic answer on that question? Like who is in ICU with COVID? Is there a relatively simple answer? Is it a lot more complex?
So through the chair, I'm sure we can provide you with those data, but very, very briefly, at a high level, the older you are, the more likely you are to have those significant outcomes requiring hospitalization, ICU admission, and unfortunately also death. That is on our dashboard. And as well, we know, hence we have more specific efforts on vaccination and further vaccination doses given to those who are immune compromised. We know that those with significant immune compromise are also clearly at higher risk of the more serious outcomes associated with COVID-19. So, Councillor, I'm certainly happy to show you what we've got on our dashboard, and if there's further information that you specifically are interested in, I'm sure we can help support addressing your interests.
Thank you. And Mr. Chair, I have one more question if you want me to squeeze it in, or maybe you could come back to me later. I don't want to hog the question time.
No, go for it. Thank you.
So just, again, just a data question, and perhaps we don't have this, again, available in a easy to follow specific form, but any data on the protection provided by masks, both to the individual wearing the mask and the data that would show the importance of protection from other people in an indoor setting wearing a mask. Have there been studies on that, or is it all just kind of sort of vague common sense that obviously you're more protected if you're wearing a good mask, and you're also more protected if others around you are wearing a well-fitting mask?
So through the chair, Councillor, there are certainly studies in respect of the benefit of masks. Perhaps what I can do is even just the most recent update that was provided by the COVID-19 Science Advisory Table speaks specifically to this and refers to some studies on masks in particular. What I might do is offline, why don't I send that to you and see if it addresses your question, and if there's further information you need after that, then I'm happy to follow up with you.
Thank you very much.
Thank you.
Thank you, Councillor. Other members of the board with questions? Director Mulligan.
Thank you, Chair. And just to follow up on that line of questioning, since today is the first day in which we've lifted the provincial mask mandates, what's your advice to people who aren't sure about what that means? About whether, should people continue masking if they have that option?
So through the chair, Director Mulligan, as I have said now on a number of occasions, my strong recommendation to people is to continue to use masks as part and parcel of a layered approach to protecting themselves and those around them. The dropping of regulations means that it's no longer required. It's not an absolute rule or must. But briefly, just because it's no longer a rule or a requirement doesn't mean that you have to stop doing it. And there are some circumstances and there are some people for whom it's really important to continue to mask. So those who themselves are older or are immune compromised, or perhaps have regular interaction with those who are older or immune compromised, it's especially important for these individuals to continue to mask, especially in indoor settings where there's lots of people whose vaccine status is unknown to you, where ventilation is not so good. These are the kinds of circumstances that we know give rise to COVID-19 transmission. Less risk when you're outside in, big airspace with people who have clearly gotten all the vaccines that they're eligible for, and where you're not quite so crowded. So these are the, I think we're actively supporting people in helping to understand how best do you make decisions. But at the end of the day, it is, I think, a good general piece of advice for people to know that we do recommend masks as an important tool, along, of course, with getting vaccinated and staying home when you're sick and washing your hands and doing the things that you've heard us say for the last 2 years now. More layers of protection just means better protection for you and those around you.
Thanks so much.
Thank you.
Other members of the board? Questions? Okay, we'll move it in speakers. I'm going to put myself on the list. Are there others who wish to be on the list? Director Bowery, Trustee Donaldson, come back if there are others. So let me begin, and I can move the staff recommendations as well. I will move a motion with 5 amendments. And just to summarize the staff recommendations, which I'll move, this includes from our medical officer of health for our MOH to report back in May on TPH functions and services that were paused or reduced during COVID and the status and the update on those services and their resumption, as well as a report back in June on new approaches that were undertaken during the pandemic around addressing inequities and how those will be approached going forward. And there are a number of other recommendations from our medical officer of health, including the 2 that she listed in the presentation that I've put on here. I also have 4 amendments, and thank you to members of the board, and I'll single out Directors Bowery and Mulligan, as well as Councillor Fillion. The first is to request our medical officer of health to revise and update our monitoring dashboard indicators to account for the new phase of the pandemic we're in. And that's one which includes increased level individual protection from vaccines, but also changes to surveillance from reduced provincial testing and reduced individual public health measures. As well, a request from our Board of Health to the province to make PCR testing available to a wider range of individuals, especially in order to ensure appropriate access to antiviral medications. And a request from our board for the medical officer of health to continue providing updated advice and clear advice to the public to inform individual assessments of risk, both for themselves and for others in the context of mask usage. Let me just speak briefly to both the staff recommendations and these that are moved. And first, as we've done for more than 2 years with a deep and sincere set of thanks to Dr. Davila and the entire team, to the residents of our city for stepping up, and to members of this board, especially in recent weeks, for engagement on a number of these. There's no question, and Dr. Davila went through it in the presentation, that we're in a different place today than we were 2 years ago. In fact, we're in a different place today than we were at the peak of the Omicron surge in January. But in saying we're in a different place, it strikes me that there are 3 really important pieces that we need to guide us going forward. The first is that COVID is not over. And as public health, as the Board of Health, I don't believe we should ever be satisfied with simply living with a dangerous virus in our midst. We must continue to do, as we do with all infectious diseases, to work nonstop to reduce risk with an equity focus. We're never satisfied. We should never be satisfied simply living with COVID. Rather, we must continue to confront it and fight it with everything we've got. The second important piece I would note is that while we may be in a new phase, this phase requires new indicators. Dr. Davila spoke to this in her presentation. We have a motion very, very clearly which speaks to this. And in these new indicators, it needs to help to update and address the current risk assessment, both for us as a board to provide the guidance and the direction that we have an obligation to provide, but also to the public to help make sense of where we are and how members of the public can best protect themselves and best hold governments to account. And the third piece for me is that we must continue to learn the lessons of the last 2 years to embed permanent solutions to ventilation, to community-led initiatives to tackle inequities, to increase supports for children and youth. To broader public health interventions on a go-forward basis, we must learn from the last 2 years, not simply be grateful that they've passed and we're in a new phase. And so the motions here speak to this transitional moment, one where, in a way, we are scaling up, not slowing down. We're scaling up to revise the indicators, to bring forward in the new business items reports from our social development department on how we tackle inequity. The work scales up. It doesn't slow down in this new phase. Dr. Davila's report spoke about this remarkable statement of unity that Torontonians have demonstrated in the vaccination campaign. 15 months, 6.8 million doses, more than 91% of those over the age of 12 with the first dose, nearly 90% with 2, 65% of those over 18 with 3 doses, that it is remarkable. It has been a collective, cross-sectoral, cross-intergovernmental approach. But now our task is harder because people feel less urgency. And vaccines are as important today as they were before. So that work must scale up. And so we may not be done with COVID as much as many would like us to be. And our work in public health continues to confront infectious diseases like COVID, as it always does. And we will have failed if we haven't learned the lessons of the last 2 years. And so that work is in front of us in April and May and June and on a go-forward basis. With that, I'll close my remarks and I will turn the floor over to Director Bauer.
Hi, I wanted to start off by saying a big thank you to all the Toronto Public Health staff for their ongoing efforts and hard work. And a big thank you to Dr. Davila for a very comprehensive report, and especially clarifying the role of public health with respect to this COVID-19 recovery. I'm very happy, as everyone is, and relieved to see that many of the metrics reported today show a decline in COVID-19 rates, as well as in the admission rates, ICU burden. And I think we should be very proud of the excellent vaccination rates that we've been able to achieve. Personally, as a primary care provider, Omicron was very overwhelming. Recognizing that while patients didn't need to be in hospital and didn't need ICU care, they needed much support from their primary care providers to guide their treatment or simply navigate the ever-changing provincial guidelines. And Chair Cressy and Dr. Davila both commented on the availability of new treatments, good treatments that are available for those with mild to moderate COVID. But these treatments are dependent on testing. We need to know when people turn positive. We cannot access these treatments without PCR testing. So optimizing access to these to testing and really optimizing access to the treatments, I think, is the cornerstone, at least clinically, in this next phase of the pandemic. The other part that's been quite overwhelming is that many of my patients, so vulnerable patients, those experiencing homelessness in our city, addictions, chronic mental health, the elderly, many of whom have been stuck at home, continue to suffer disproportionately. And access to public health programs, social supports, specialist care in hospitals continues to be an uphill battle for them as patients and for me as a healthcare provider, trying to access these for them. So I'm very relieved and delighted to hear Dr. Davila speaking to this today, advocating and collaborating with health partners, as well as reassessing where we're at with public health programs and using this to update the indicators of our dashboard, because this information is going to help keep our community informed, which in the new phase of the pandemic, I think is most important for us to know where we stand. With regard to strengthening the ongoing efforts for COVID-19 vaccines, I was very fortunate to participate in one of the pilot vaccine programs at my site, and I recognize that I'm at an academic hospital-based site, so this may be nuanced. But it was so well received by patients and their families. And I'm certain, and they always ask, can vaccinate our children? Can we bring our family members? They recognize the importance of that trusted relationship with us. And I think especially to catch up with the children, the 5 to 11-year-old children, really leaning on primary care providers to boost these efforts will be really important moving forward, not just at sites like mine, but deeply rooted in the community as well. Lastly, I wanted to comment on the global vaccine equity piece that Dr. Davila spoke about. Many of you might know, but my elderly and vulnerable parents live in sub-Saharan Africa. And they had access to AstraZeneca vaccines in August and September of last year, donated by South Sudan via the COVAX program. mRNA vaccines became available for them, for their cohort, last month. So that's 1 year, more than 1 year, after Canadians of the same vintage started to be vaccinated. So my mum got COVID in December, and she was a healthy, very healthy 70-something-year-old lady, and she's still recovering. So the irony is that I spent all my spare time vaccinating other people's loved ones here in the GTA, and my own family had no access to a vaccine that was going to keep them safe. So, Dr. Davila, I'm personally thankful, grateful for your advocacy, because that's going to help keep my family safe and the family of many people I care about around the world safe. So please don't give up on those efforts internationally as well.
Thank you, Director Bowery, and I think on behalf of all of us, we wish your mother a speedy recovery in what has not been an easy moment, I know. Trustee Donaldson.
Thanks. Through the chair, I really just want to express so much gratitude. So much gratitude to every single person who works at Toronto Public Health for everything they've done. Specifically on today's presentation, I also wish to continue to show gratitude for the partnership of Toronto Public Health with our Toronto schools and what that has done for children and youth and families in this city, and how important it is, and how grateful I am to see that the collaboration is as strong as ever, looking towards the future and for our recovery, which is so important for our city. I also want to express gratitude to every single one of my colleagues on this board, and for their continued engagement, and for these additional recommendations today, which are fabulous. And of course, thank you to our chair, whose leadership continues to be really instrumental in what's happening in our city, and just so much gratitude. Thanks.
Thank you, Trustee Donaldson, for the group hug. We all feel it. Councillor Fillion.
Thank you. I also wanted to say a big thanks both to Dr. Davila and to you, Mr. Chair, to everybody really, but the two of you, and I can't imagine the hours you've worked the last couple of years, and it feels great to live in a city where the health leadership are so on top of things. So just a big thank you for that. I know it comes at a big personal toll for both of you and for others in Toronto Public Health. I just wanted to just talk a little bit about what I think is, and it's covered in the motions. Thank you. The importance of letting people know where we stand. I feel that we're in a very kind of confusing and unsettling period. I've had two people close to me over the last week express surprise that I was still trying to, going to great pains to avoid getting COVID, like that was somehow naive, or, aren't we kind of past that now? I've had two mothers of, and I disagree with that. I am still trying to avoid getting it, but it's, you start to wonder. I've had two mothers of young children in the past week say to me that they, aren't sure how to navigate this. Can they, their children are too young to wear a mask or to be vaccinated. Can they take them into, out shopping now into a place where people are both unvaccinated and unmasked? Is that safe? I know, strangely, two people who have had 99-year-old parents who got COVID, and one is remarkably fine and the other passed away. And there are so many kind of contradictory and confusing things in our everyday lives. I'm somebody who kind of searches for information and data, to try to figure out how to navigate this. I would certainly continue to wear a mask, and even did a lot of research on getting absolutely the best masks I could find. But will I go into retail where they aren't still requiring masks? I probably won't, or I will not if I can avoid it, but is that being overcautious? And the answer is, I don't know. Even as somebody who spends an unusual amount of time trying to follow all this from a layperson's perspective, it's hard to follow. It is hard to know. It is hard to know how to protect yourself, or the 99-year-old parent that you're still in contact with, or the 3-month-old baby you're still in contact with. So just anything that any information we can provide the public in as easy and understand way as we can do that, I think that becomes really important moving forward. Thanks.
Thanks, Councillor. Anybody else who wishes to speak on this item? Okay, don't see anybody. So then there are the staff recommendations, as well as the 4 additional amendments. Can we take those as a package? All right, so to the clerks, can we all those in favor of the item as amended as a package? Okay, opposed if any? Seeing none, that carries unanimously. Let me just confirm with the clerks. Clerks, do you need item as amended, or did I just do item as amended?
It sounds like you just did item as amended as well, Chair. So
that's what I thought. All right. So thank you to the deputants, as well as to Dr. Davila and members of the board. Brings us to our next item, which is item HL 35.2, Ontario Public Health Standards Risk Management Reporting for 2022. This is the requirement under the Ontario Public Health Accountability Framework. We do have one speaker on this item, and so we'll hear from the speaker and then bring it into committee. Is there a Greg Nittle on the line?
Yes, speaking. Hello, Councillor Cressy. Can you hear me?
Greg, we can hear you fine. You'll have 5 minutes, and you can begin when you're ready. I'll give you a heads up when there's about 30 seconds left.
If you could give me a heads up at 15 seconds left, please.
Yep, I will do so.
Okay, I address these comments particularly to my councillor, Mr. Paul Ainsley. Please see my Substack, F2, S as in Sam, G as in George, .substack.com for the speech notes and references. I think the common factor that underlines the 6 risks the medical officer of health outlines in her risk report is how TPH engages with evidence. Here are some examples. First of all, censoring Dan Hartman. The YouTube minutes for the January 17th meeting censor most of Dan Hartman's comments about the death of his son, Sean, shortly after a COVID-19 vaccination.
Greg, I'm just gonna pause you there, and I've paused your time. Just want to make a note for the record that following January's Board of Health meeting, the City Clerk's office received a complaint that one of the speakers at the meeting disclosed the personal health information of a minor without authorization. The City Clerk reviewed the complaint and consulted with colleagues in privacy. Their review confirmed it was personal health information being shared without consent and confirmed it should be removed. The video edit required the removal of the entire speaker, but the individual is still listed as having spoken. This was a decision of the City Clerk, and so I would ask that in the rest of your deputation that you do not disclose information of a minor without consent. I'll start your time again. Thank you.
Sorry, how could a minor who's dead possibly consent to releasing information? Okay, so I'll try. So Dan might not be handing you a double random control try, but he has gone to give the trouble of trying to report evidence to you. Public Health Ontario, in how vaccine safety is monitored in Canada, states that in Ontario, passive vaccine safety surveillance relies on reporting of AEFIs, which are adverse events following immunization by healthcare providers, vaccine recipients or their caregivers, to their local public health unit. That's you. It's deeply disturbing that 1 full year into the rollout of the COVID-19 vaccinations, the Toronto Board of Health did not understand that Toronto Public Health is the correct reporting channel for adverse events following vaccination. So censoring his speech is not protecting Dan's privacy. It is cruelly denying his natural healthy instinct to grieve publicly and continues to shred any residual credibility Toronto Public Health might have, including relating to mental health. I condemn the board for adopting the January 17th minutes this morning without reversing the censorship. So you now, it's not the board, you own it, right? You can't blame it on the clerks. You accepted that censorship. Second topic, vaccinating children for COVID-19. Public health authorities in Florida and Sweden no longer recommend vaccinating healthy children for COVID-19. For Florida, see guidance for pediatric COVID-19 vaccines dated March the 8th. And in Sweden, translated from the Swedish, no general vaccination against COVID-19 among children 5 to 11.
Greg, did we lose your audio there? I've just put your time on hold. Nahom from Clerks, did we lose Greg there?
To the chair, it appears that they're no longer connected to the meeting. We didn't do anything on our end to mute the speaker or disconnect them. We're hoping they'll reconnect on their own if we give them a moment.
All right. So members of the board, I've paused. I've put the time on hold. I'm just we'll give them a moment. Greg, if you're watching, if you could please reconnect. The clerk's office is waiting to connect you. So Nahom, let me know if you're able to reconnect. If not, we'll hold this down and come back as we deal with the other items, and we'll see if he's able to reconnect. Okay, so board members, what I'd suggest, because we're in the middle of the deputation, we'll give them a chance to try and reconnect at 2 minutes and 56 seconds. I'll hold this item down because he's speaking on it, and perhaps we can go to the other items to deal with them, and we'll come back. So that item is held down, and Nahom, if you could let me know if the speaker is able to reconnect. We then have 3 new business items, so we'll proceed in order. The first is 35.6. This is a request for an update on TOsupports. You should all have a copy of this new business item. It was also put up on the web portal, but this is a request for from the Board of Health to our MOH in consultation with Social Development and Finance Administration to bring a report to our April meeting on April 11th with an update on our equity action plan through TOsupports, as well as an update on the work of the vaccine engagement teams and community ambassador program. So I'm happy to move that. Are there any other speakers on that item?
To the chair, this is the host. I believe we've been able to reconnect Greg.
Nahom, I'll return to it after we've dealt with the item we've just moved to. So if you could just keep him on mute for the second, I'll return.
Thank you.
Thank you. So this is item HL 35.6. This is the new business item for that request on TOsupports. I'm happy to move the item. Anybody else wish to speak on that item? All right, we'll just place it. It's an item for the report in 3 weeks. All those in favor? Opposed, if any, that one carries. We'll now then return, if we've got the speaker reconnected, to item HL 35.2, the Ontario Public Health Standards Risk Management Reporting. Greg Niddle was speaking. Greg, we paused your time when your connection dropped at 2:56. Nahom, if you could unmute the speaker.
I'm sorry, Chair.
Greg, welcome back. You can begin when you're ready at 2 minutes and 56 seconds.
I'm sorry, Chair. It looks like after we reconnected the speaker, they chose to disconnect.
Okay. All right. So we'll bring that item into committee. So this is the report on the Public Health Standards Risk Management. Are there any questions for staff on this item? Okay, seeing none, into committee. Would anybody like to move the staff recommendations to receive this item? Moved by Councillor Ainsley. All those in favor? Opposed, if any, that carries. So there are 2 new business items left then. Item HL 35.7, request for an update on the impact of the COVID-19 pandemic on children and youth. I'll speak to the recommendation first and then open it up. This is a recommendation from Trustee Donaldson and myself that the board requests the Medical Officer of Health to bring a report to our April 11th meeting with an update on the impact of the COVID pandemic on school-age children and youth, outline current programs operated by TPH to support this population, and any additional recommendations for the board's consideration. Trustee Donaldson, did you want to speak briefly to this item?
Sure. Thanks, Chair. So Dr. Davila herself said this morning that one of the things that's happened during the pandemic with our school-age children is the move to remote, and some of the evidence that we have for the detrimental impacts that that's had on our children and youth. So I really think at this point in the pandemic that we need a bit of a closer focus on children and youth and what the impacts are, what the data is saying, what data is missing, in particular, how we can leverage our partnerships that have been strengthened during the pandemic, including our schools and clinical settings and community level supports, and go all in for our children and youth. At this stage, I don't think that they can afford to wait for the interventions that are well needed. Thanks, Chair.
Thank you, Trustee Donaldson. Anybody else to speak on this item? Director Mulligan-Katz are welcome to participate if there's any words of wisdom. Okay, seeing none on that item. So it's we'll have that our next meeting, I should note, is April 11th in 3 weeks. And so, and I know Trustee Donaldson and myself have already been meeting with the schools team and Dr. Davila, so the work is already underway on the report. So all those in favor, opposed, if any, that carries. The final new business item is item HL 35.8. This is not for a report back. It is for recommendations here. And it's bringing a public health lens to indoor ventilation requirements. Director Mulligan, do you want to say a few words on this item? And then I might follow you with a couple.
Yes, thank you, Chair. When there was a cholera epidemic in the 19th century, we saw a global revolution in water and sanitation. Now we have the COVID pandemic, and we need to see a worldwide revolution in air quality, and ventilation and air filtration. It's something that we need not just for COVID, but for future air quality related risks, other viruses, and so on. And it's something that I think is overdue. Many individuals across the city, the province, the world, stayed home and followed public health protections in order to buy government's time to take action. And this is one of those actions that need to be taken at a governmental level to help protect us going forward. So I'm very pleased to be part of supporting public health in ensuring that a health lens is taken on air quality standards going forward. And I urge all board members to stay closely apprised of how we're doing when it comes to ventilation. Thank you.
Thank you, Director Mulligan. And if I could just, to build on that, the recommendations here, as we are seeking to direct divisions in the city that we do not directly control or oversee as the Board of Health, the recommendation here is for City Council. So we're forwarding this to City Council for City Council to request our municipal licensing and standards, as well as the chief building official and Toronto Building, to look at the property standards bylaw on ventilation, as well as for the executive director of the Housing Secretariat to look at ventilation in the context of the implementation of our tower renewal program. As well, there are recommendations here for the other orders of government around continuing to review transmission and to do their own changes around the property standards bylaw. So that is in front of us, and that is why, just for clarity, why it is City Council, because we do not direct those departments, but we are going to roll this rock up a hill and follow Director Mulligan's wise words. So anybody else to speak on this item? Okay, seeing none, all those in favor? Opposed, if any, that carries. Members of the board, that completes this agenda. Before we conclude, if I could just say our next scheduled meeting is in 3 weeks on April the 11th. I know in advance it's going to be a busy agenda, and there are a series of reports coming on a range of topics. So if possible, if you could schedule your days with the assumption that we will be going past the lunch recess. And I thank you for your indulgence on your time for that. And with that, that concludes our agenda. So to the board, thank you, and to the team at TPH and Dr. Davila, we still need you. Keep going. Thank you kindly. All the best.